Disease made simple. Diabetes. Everyone has heard of someone with diabetes, a relative, a celebrity, a neighbor. But what is diabetes exactly? Other than one of the most prevalent diseases in the world, affecting roughly 1 in 10 people, and increasing, like the cost of gas, diabetes, or diabetes mellitus, is a metabolic disease where healthy levels of sugar in the blood cannot be naturally maintained. When we eat, sugar, or more specifically, glucose, is absorbed through our digestive tract and into our bloodstream, and typically stays there if we don't have insulin. Insulin allows glucose to be transported from the blood into other body tissues to be used as energy. It is the pancreas organ that produces all the insulin in our body. Insulin also allows us to build muscles and store fat as energy reserves. This is why it's known as the storage hormone. There are two types of diabetes. Type 1 diabetes, representing about 10% of cases, is an autoimmune disease where the body produces antibodies, which are like angry immune system soldiers, to attack the cells producing insulin, which causes a deficit of the hormone. This is especially seen in younger patients, but can develop at any time in life. Type 2 diabetes is the most common form of the disease, representing 80 to 90% of cases. It occurs most commonly in older patients, but there is a growing number of youth developing type 2 diabetes. This form of the disease is caused by insulin resistance, which means that your body becomes resistant to insulin and the hormone can no longer exert its effects. An important cause of decreased sensitivity to insulin is excess body fat, but there are also other causes, including genetic susceptibility. Symptoms that are classic in diabetes are increased thirst, increased urination, and increased hunger. But if left untreated, can cause symptoms as severe as loss of consciousness, seizures, and even coma. Long-term complications include permanent damage to the eye, nerves, kidneys, and blood vessels.